Shwmae, Phil Clod dwi, Prif Weithredwr Bwrdd Iechyd Hawl Dda. So hello, I'm Phil Clore. I'm the Chief Executive of Hawl Dda University Health Board. The Community Design Programme is about creating a health and care system that works around people, not just organisational boundaries. One of the challenges we've been examining is what happens when someone's health suddenly deteriorates and their need is urgent, but not life-threatening. At these moments, people need services to respond quickly and seamlessly. The work we've been doing is focused on bringing health and care organisations together to provide a rapid response, improve outcomes for individuals while making better use of our resources available across the system. What are we trying to solve with our approach to community by design, and in particular, our emerging model for urgent and same-day care? Our current system is inconsistent, confusing, disjointed, hospital-centric, risk-averse, and medical by default. Now, you may not agree with all of those things, but I think you understand the gist. We also need to recognise that the vast majority of care is provided within primary care and community services already, not 999 and not our emergency departments. So how do we change something that has been deeply ingrained within our population, our services, and our collective cultures and mindsets for too long? Our model begins with people living their everyday lives until an urgent care need arises. The first step is easy access. People and professionals need simple, clear, and accessible routes to urgent care. Whichever route someone chooses, they should be connected to the help they need without being passed unnecessarily around the system, ideally being just one step away from the care they need. The next step is rapid assessment. The person's needs and their level of urgency should be identified as early as possible through triage and by appropriately trained clinical decision makers. That assessment should navigate them to the right response, reducing duplication and the number of times people have to repeat their story. This should be followed by a timely response. The response should reflect the person's needs, level of risk, and what matters to them, starting with whether those needs can be safely met at home or within their community. To provide a genuine alternative to hospital, we will need to bring more services into the community. This will mean expanding access to urgent diagnostics and treatment, specialist advice and team-based assessments, and where appropriate, hospital care at home. Our model deliberately places a greater emphasis on the community sector and the interoperability between our services. Care must remain readily available for people who need emergency and specialist treatment or admission when they need it, while credible and responsive community alternatives are provided for those who do not. Urgent care does not end when the immediate episode has been treated. Care should remain coordinated through recovery, condition management, and prevention, supporting a safe return to normal life and longer-term well-being. Delivering this model will require clear pathways, community capacity, and a workforce able to work across boundaries. Shared information and reliable digital systems must support clinical decisions and responses to demand. It will be developed with people, communities, and partners across health, social care, local government, and the third sector. Together, this should create a more coordinated urgent care system that improves continually and provides safer, calmer care for patients, families, and staff. We would like your help and feedback on this emerging model. We are particularly interested in what feels strong and credible, what would enable it to work in practice, and whether there is anything important we have not yet considered. Please reflect on these 3 questions. Firstly, what elements of the model are particularly strong? What will enable the model to work in practice? And is there anything important that is missing or needs further consideration? Your experience and expertise are essential. We are now inviting your feedback to help us strengthen it, understand the challenges associated with implementation, and ensure that it is practical, credible, and deliverable across Wales. Please share your thoughts by completing the linked Microsoft form on the engagement portal. Thank you for taking your time to contribute. We look forward to hearing from you.